Thank you, Chairman. First, I'd like to thank the organizing committee for allowing me to share my experience in HIFU. It's really my honor and pleasure to be here today. I'm going to talk about changes in quality of life after HIFU for fibroids and adenomyosis. Everyone knows about this quality of life measure, but unfortunately, in a lot of studies, this is not reported. Particularly for the detailed part of the quality of life. So I'm going to show my experience from a day center for treatment of HIFU in Hong Kong. Uterine fibroids, I'm going to be quick here. Fibroids are the most common benign uterine tumor, affect 20 to 50% of women in reproductive ages. The symptoms including menorrhagia, mass defects, and fertility issues. Symptoms can have negative effect on the quality of life, and measuring the symptoms and quality of life of women with fibroids is important, and it is a major indicator for treatment. So most studies report indicators of treatment as the reduction of fibroid size, but as I want to illustrate here, this quality of life is equally important. So this is the questionnaire. It was described in 2002. It is called the Uterine Fibroid Symptoms and Health-Related Quality of Life Questionnaire. It was designed to assess the whole spectrum of fibroid-related symptoms and its impact on the quality of life. It consists of a symptom severity score. We usually say SSS. It consists of 8 items. It is rated for each item. It was rated as 5 ratings, from 1, which is not at all, and to 5 is a very great deal. There are questions on usual symptoms of uterine fibroids like menstrual periods, pleasure symptoms, urinary symptoms, and fatigue. The other part of this quality of life questionnaire is the health-related quality of life. It consisted of 29 items, and for each item, it is rated from 1, which is none of the time, to number 5, which is all of the time. The important thing is it consisted of 6 domains, which is generally all the time neglected by most of the researchers when they report quality of life. It consists of concern, which consists of 5 items, activities of 7 items, energy or mood 7 items, control 5 items, self-consciousness 3 items, and sexual function 2 items. And there's also an overall quality of life score, which is referred as health-related quality of life. And most of the time in researches we see related to fibroid treatment, they usually most of the time report the overall quality of life. And in fact, the score we get from adding the scores together is called the raw score, which is the added score from all the items. And in fact, there is what we call a transformed score, which is a score to a 100-point scale. The way to calculate the transformed score for symptom severity score, the transformed score is measured from the actual raw score minus the lowest possible raw score over possible raw score range times 100. On the other hand, for the quality of life health score, the transformed score is measured from the highest possible score minus the actual raw score over the possible raw score range times 100. So you look at that, for symptom severity score, the lower score is better. So lower score means improvement, all right? But for the health-related quality of life score, higher score is better, all right? So for symptom, we want a lower score. From quality of life, we want a higher score. So you need to make sure that. So in Hong Kong, we do have a Chinese translation version, and it was validated. It was reported in 2019, and this is the score we use for our patient. So I would like to report our results on in a center that I work in. It was open in 2019. This is the first day center in Hong Kong that provide HIFU treatments for fibroid and adenomyosis. Up to March 25, we have done 664 cases. We started the use of the UFS QOL questionnaire in 2021. It is just an online form that patient fill out by herself. The questionnaire is completed before treatment, 3 months, 6 months, and 12 months after treatment. And patients were reminded through phone messages at specific time periods to complete the questionnaire. The summary of the review include the review period is from December 2021, which is when we first started the review, up to June 2024. The response rate in completion of questionnaire is part of our review. We obviously would like to report the changes in symptom scores after treatment for fibroids. We would like to report the health-related quality of life score after HIFU treatment for fibroids, specifically on each domain or subscales they call. And also I will try to look at the application of this scoring system in the use on adenomyosis. The response rate, unfortunately, if you see the response rate is not totally satisfactory. For the pre-treatment response rate, the response rate is up to 98%, which is quite good. However, for post-treatment, in 3 months, the response rate is around 70 to 76%. For 6 months, it's around 60%, and for 12 months, it's only close to about 40%. For the symptoms for fibroids, the symptom scores and the total scores are illustrated in red color. To make it easier to see, you can actually see that the symptom score actually decreases as after the treatment. So you can see that at 3 months and 6 months, the symptom scores has improved, which is what we expected. And at the same time, if you look at the quality of health, it shows a corresponding increase in symptoms, in quality of life, which means that if patients have improvement of symptoms, then the quality of life will improve. So you look at the domains on each domains, which most of the researchers do not report the individual domains. So if you look at the domains of these health quality of life, I really haven't done very detailed statistical analysis, but if you look at that, we can see that the domain on concern and self-conscious is actually more significantly affected than patients with fibroid, than domains on activities and energies and sexual function. So if you look at the table here, you can see that the most affected part on the quality of life is concern and self-consciousness. What if I want to use our data to compare with the other studies, in the validation studies I mentioned earlier, they also have some data on the quality of life in different domains and post-treatment. And also in the very early part, when the paper described the original version of the quality of life, they also have data on the normal value. So when we compare that, we can see that, again, concern and self-consciousness are more likely affected in patients with fibroids. Activities, energy, or mood are less likely affected. However, sexual function is not that definite within these studies. For adenomyosis, we have some data, but because the number is not that much. So again, I only look at the symptom severity and the quality of life, the overall quality of life. And again, you can see the corresponding change with improvement of symptoms after treatment of adenomyosis by HIFU. And we can see the corresponding improvement of the quality of life. We then look at the different domains. This is the graph from different domains. And again, it was shown that concern and activities are more likely affected than self-conscious and sexual function, which is slightly different from that from fibroid. But however, the number of responses are too small to make comparison. And also, some of our patients for adenomyosis are given GnRH after treatment, so it can clearly affect the response of this result. So in summary, uterine fibroid symptomatology and quality of life score is a reliable tool for the assessment of symptom severity and quality of life. It can also be used to evaluate the efficacy and treatment effects on fibroids. The evaluation of health-related quality of life should include assessment of separate domains instead of only the overall health-related quality of life. Obviously, correlation of this scoring with fibroid size will be useful. The overall poor survey response, especially at 6 to 12 months after treatment, is noted. I suggested that effort should be made to improve the quality, improve the response rate. There are some suggestions here, either by more frequent reminders or modifying the response time, such as we can ask them to report between 6 to 12 months, so they don't need to report so many times, or in other words, to reduce the number of required response. So this may increases the compliance of the survey. The usefulness of using the UFS-QOL in women with adenomyosis requires further evaluation. Thank you for your attention.
Thank you，非常感谢张教授的精彩分享啊。那么确实改善这个病人的症状是我们治疗的目标。那么他通过这样一个量表来结合自己的这个中心的这个数据，也和其他的数据进行了比较。那么我相信，那么随着后面的数据的增加，一定会得出更加精彩的这个结论。谢谢 ，Thank you。